Yes. Ngoja tulie like 20 minutes alafu urudie vitals. Yeah. Yes, welcome to today's session. We have been dealing with cases concerning the heart, and we are still continuing. We talked about dilated cardiomyopathies. We talked about dilated cardiomyopathies, and we said cardiomyopathies are diseases that are affecting the heart. Diseases affecting the heart. We introduced them, and you see the symptoms are like the same. Symptoms are like the same, but the problems are different. So we are at the second one. The first one was dilated, and it was giving us a symptom of shortness of breath, fatigue, swollen legs, palpitation, hypopnea, paroxysmal nocturnal dyspnea, and chest discomfort. These were the problems that we were getting from dilated cardiomyopathy. Now we have another second type cardiomyopathy that is called hypertrophic. Today we want to introduce hypertrophic. Hypertrophic is another one. The first one we talked about was a problem with dilation. Dilation is ventricles of the heart are extended, they are large. So sometimes when the ventricles are large, blood comes back to the heart. So wherever you're watching from, big up every time. Let's talk about hypertrophic cardiomyopathy. Let's talk about hypertrophic cardiomyopathies. And when I say cardiomyopathy, you really need to understand it's not a hard name. Cardiomyopathy is just a name to say diseases of the heart. So today, the first one was dilated. Today we are talking about hypertrophic. And what is a hypertrophic cardiomyopathy? When someone says, dilated, we saw that these ventricles of this heart, when we talked about dilated, we said that the ventricles of this heart are bigger, they are dilated. The ventricles are bigger and dilated. So today we want to check on another thing. Federico Dautin, hi Federico, how are you doing? Welcome to this medical channel. Here we discuss about medical issues. So you subscribe and hit the like button as you continue. So hypertrophic cardiomyopathy. The first one was dilated. Dilated means big. Diseases of the heart. What is hypertrophic? This is a genetic heart muscle disease characterized by unexplained thickening. Now look here. This is your heart. Look here. This is your heart. And the muscles, because these are the muscles of the heart, they thicken. They become thickened. They become so thickened and unexplained. You can't. Are you talking about the heart? Yes, I'm talking about the heart. I'm talking about this heart. And see, this is your heart. And the diseases that you can get. So today we are dealing with the second one. If you are new, please watch the previous ones, you will understand. So hypertrophic cardiomyopathy is a disease that, you see, the heart muscles are thick, unexplained thickness. You just have thick muscles of the left ventricular myocardium. The left side of the heart is where oxygenated blood comes, and then it is pushed out from the outer, and the coronary vessels come back to the heart to give the heart muscles oxygen and some. So most common affecting the intraventricular septum, you see, the left side, and most common it affects this one, the one that separates the right and the left, the oxygenated and oxygenated blood. So most common affecting the interventricular septum. The thickened muscles make it harder for the heart to relax and feel properly. So if these heart muscles are not flexible, what will you have? You will have some hard time to pumping, because the muscles should be flexible, flexing well, flexing well. But now we have the interventricular septum, which is thickened. Even relaxing is a problem. This is whereby you have hypertrophic cardiomyopathy. Or if you're coming in right now and you're new, we did heart attack. But besides heart attack, we saw that we have other different types of heart diseases. Other different type of heart diseases are also called cardiomyopathy. So we discussed about dilated, we discussed about hypertrophic, and this is what we are discussing right now, hypertrophic. The thickened muscles make it hard for the heart to do what? To dilate and relax and feel properly during systole, and in some patients obstruct blood flow. Sometimes when these muscles are thick, the valves will have a problem. So blood flow in the heart will have a problem. You see? So you if you ever had someone has gone to hospital and this person is always having blood pressures that are low, just know it may be hypertrophic. Sometimes even high, because the heart may be pumping hard. Kathleen Cruz, hi. Snado Kathleen said hi. Welcome everyone. I'm just starting right now. So if you have a question, post it. We are discussing cardiomyopathies. So welcome, and don't forget to hit the like button and subscription. Leave your subscription there. Most of these problem is not like dilated, which is brought by Kathleen Cruz is Snado. Welcome. In dilated cardiomyopathy, most of it has something like alcohol intake, genetic disorders, some problems like thiamine deficiency. Thiamine is vitamins. But here, most of the hypertrophic, these muscles becoming hypertrophied, they are thick, they can't relax, and most of these problems are brought by genetic disorder. Normal, the left ventricle, the left ventricle, let me see it like this. The left ventricle pumps blood in the outer, the left ventricle outflow the outer. In this problem, normally the left ventricle pumps blood to the outer, to the body. The right ventricle pumps blood to what? It pumps blood to the lungs. So in hypertrophic cardiomyopathy, what we see is the ventricle muscle become abnormally thick, especially this muscle here that separates. The ventricular septum is usually affected more than the free wall, and this one is mostly affected. The ventricular cavity becomes smaller. Blood has difficult filling the ventricles during the diastole. Because if your muscles cannot relax in a good way, what will happen? You will have a problem when it comes to relaxation. You will have a problem. Kathleen Cruz, welcome. I can see you. By the way, Kathleen, tell me, which country when you come in, please tell us which country you're from. You see, tell us which country you're from, where you live, so that we can interact well, This is Dr. Ben from Kenya. And Africa. Kenya is in Africa. So welcome. This channel will discuss medical issues and medical stuff that are important. So when you are here, feel free to ask anything. Kathleen Cruz, Nado, everyone who is here, like let me see, Federico, everyone that is here, big up yourself. No problem when you are here. So for now as we continue, what we do, Ask a question. Let me come, my friends. Let me come. Let me take something and come. As you watch this heart there, as you watch that heart. Yes, so we were talking, do you want to be friends? Of course, we want to be friends. Welcome, Dorothy, I'm here. I was handling a patient. Subscribe, Kathleen Cruz. I like having friends. You subscribe and let's communicate. Let's continue communicating. So we had talked about something that is called hypertrophic cardiomyopathy. Hypertrophic, let me get to see here. Yes, Kathleen Cruz is still here saying hi. Now, we were talking about hypertrophic. When I say hypertrophic, just know I'm talking about something that is thickened. Something that is thick, a thick substance that you cannot, something that is thick. So here, at hypertrophic cardiomyopathy is something genetic. And this is the problem when it comes to hypertrophic cardiomyopathy. The ventricular muscles become abnormally thick. The ventricle muscles become abnormally thick. And then you will find that the intraventricular septum, this one, the one that is here, between it, it's the one which is always affected. It's always affected more than free walls, more than these ones, these free walls outside here. You see, the ventricle cavity becomes smaller. The muscles become stiff. Blood has difficult filling the ventricle. Sometimes even blood does not go to the ventricle. It goes slowly because relaxation and it becomes a problem. In many patients, the thick septum partially blocks blood, leaving the heart during systole. This means like this. In many patients, the thick septum, this one, the ventricular septum, partially blocks blood. It partially blocks blood, leaving the heart during this one. You know, when this one has constricted and this one is not relaxing, sometimes it blocks blood to come inside the ventricles. So it leaves the blood to be, it's called obstructive hypertrophic cardiomyopathy. Obstructive cardiomyopathy. About 70% of patients have it. Many of the patients have it because we have seen many of the patients are affected by this septum here. So the anterior leaflet of the mitral valve is pulled towards the septum during systole. Systole anterior motion. It's called systole anterior motion. Mitral regurgitation may occur. You know, mitral regurgitation means blood comes back to the lungs because this thing is not relaxing and coming back normally. Non-obstructive hypertrophic cardiomyopathy, no significant obstruction is there. There is no significant obstruction. Symptoms may result in poor ventricular relaxation and arrhythmia. So in hypertrophic cardiomyopathy, people may get bad symptoms, and these bad symptoms, either you have fibrillation or you have bradycardia, and that means either your heart is beating so faster, your heart is vibrating instead. You know, when we talk about fibrillation, we talk these heart muscles are kind like doing vibrating instead of pulling. You see? No obstructive left ventricular obstruction. Symptoms result in mainly poor ventricular relaxations and causes. What are the causes? Genetic causes are the first causes of this because there are some proteins like MYH7. Those are. Do you talk English? Of course, I'm talking English, Kathleen. We have other things like secondary causes. Secondary causes are hypertension, causing left ventricular hypertrophy. When you have high blood pressure, you may have this side of the heart being bigger than this one. It's called hypertensive crisis. Aortic stenosis. Stenosis, thickening or shortening. Stenosis is shortening. Amyloidosis is a protein mutating to something else. There are so many things you can get. Secondary causes of this problem, fibrosis, even trauma, mitochondrial disorders, all those, Noonan syndrome, Friedreich ataxia, Pope disease, very many things that are here that are causing all this. And you may get that we have pathophysiologists like how this disease start. We are friends, so we can play something. Play something. Tell me which one. Like which one? Play something like. Now, mutations affect the heart muscles. Mutation is changing from normal to abnormal. Then you get to myocyte disarray. Instead of being aligned, muscles become disorganized. Now that the protein of the ventricles have been affected, why am I the only person who is speaking? Because others are listening, maybe. Others are listening, maybe. So let's continue. If you're coming in and you're a new person, let's get to know where you're chilling at, and let's get to understand which side of the country you are from, so that we can interact. We have just started. I think it's 20 minutes from when we started, and everyone is listening. Don't just scroll away. Come in and leave your like. and let's continue doing what? Supporting each other. Now, let's continue. So, when this myocyte, the muscles have been affected, there is a mutation on Catalin is asking me if I'm rich. I don't know if I'm rich. I'm just living. So these heart muscles are affected, and they become disarranged. So myocyte disarray. Instead of being aligned, muscles fiber become disorganized. Fibrosis, then you form something that is fibrous, hard thing that cannot relax or contract well. So left ventricular obstruction, aortic obstruction, this one is a bad one, because when this one is thick and then it's obstructing the aorta, we will have several problems. The thickened septum, anterior motion, and mitral valves narrow and outflow. Increase the pressure gradient in the, because if you block, see you, if you block here, blood will fill and the pressure will be high, So the thickened septum and systole anterior motion, mitral valves, the outflow increases the pressure gradient. So you start having arrhythmias, fibrosis, myocyte disarray, disruptive electric conduction, increased risk of atrial fibrillations and ventricular tachycardia. You see, very important. Symptoms is like you can have chest pain. Sometimes you can have chest pain. Let's see. Let's see something here. Sorry for that disruption. Sorry for the disruption. It was a network issue. Now let's continue. Catalin is still here. Very funny. Catalin is still in the house. Very funny. No worries, Catalin is here. Now, we were talking about symptoms of having this problem. Common symptoms are shortness of breath, especially on exertion. Chest pain. Some people have chest pain. Fatigue, palpitations, syncope, exercise intolerance. When you are doing it, symptoms are just like the other ones that we had on dilated cardiomyopathy. They share the symptoms: shortness of breath, chest pain, fatigue, palpitations, dizziness. They share. Now we have severe symptoms. Severe symptoms like heart failure, sudden cardiac arrest, and not people are watching. I'm happy. No worries. Sudden cardiac death. All those are affected. All those are the bad symptoms that heart attack is not a good thing. Heart failure is not a good thing. When your heart cannot pump blood in the best way that it can, they become a problem. It becomes a problem. Now, when you examine this person as a medical practitioner, you have had double apical pulse, maybe press it. Sometimes you get to take the pulse, you find you touch like this, the apex beat. You may get it by just touching where you want to feel it. So you start feeling some apical pulse, brisk carotid pulse, and apex beat, forceful, sustained apex beat. You may get the fourth heart sound. There are two. Oh, Smiler in the city is in the house. Smiler in the city, welcome. Today we are talking about a different type of heart condition where the heart muscles are thick. They cannot contract, relax well. They are just thick. Your heart muscles cannot pumping blood, and Sometimes you feel that the septum between it is blocking blood from the left ventricle going to the body. All the symptoms of this are same, just like the other one that was called dilated, because the main aim of your heart is to pump blood to the body, and also to help itself by pumping blood through coronary artery. See, and even to help the brain to receive oxygen. So the symptoms that we get through these heart diseases are same. And don't once, some people when they are at home, they can like say, my friend was using this drug, or my mom or my dad was using this drug, and I'm feeling the same as him. So I think the best way to do is just to continue with the drugs that he was using. No, even if it is genetic, go to the hospital. Let the doctor decide which drugs, because your dad may be suffering from dilated cardiomyopathy and you are hypertrophic. Maybe you drink alcohol. Jamaican uncle, greetings. Can someone take something in the chat? Hey, Cataline is tired of us texting alone. Cataline is our new friend. Caitlin Cruz is our new friend, and he wants to know people. Cataline, here we have very many friends. We have Jamaican uncle. We have a Smiler in the city, and more that you will see in the chat. Cataline, Smiler in the city, and Jamaican uncle are in the house. Dorothy has been here. All of you that you are here. So don't worry yourself. They will talk to you. We are many people, and we create friendship at all costs. Now let's continue to talk about something that is called about the symptoms. This heart condition, if you are not getting enough oxygen to the red blood cells, and the amount of volume of red blood cells that is circulating in your body is down, it is being blocked to the ventricles, you can have the same symptoms as others that have different condition. And that's why some people use drugs wrongly. You share drugs at home. You have seen some people when they are at they have the same condition. They have the same condition. What they usually do is you get to take drugs that someone else were taking, like in dilated and hypertrophic. You may get that the person who is using in dilated, that person is using diuretics like furosemide, spironolactone, and then in hypertrophic, this person is not using diuretics like those ones. So you start taking medications that are not supposed to be taken. So it's very important to go and get the right diagnosis, because symptoms are same, but the condition that is bringing these same symptoms they are different. These conditions are different. So the dilated hypertrophic cardiomyopathy and the two is a totally different thing. You see, this one has stiff muscles. Dilated, they are overextended. Can someone say something in the chat? That means you are a real angel. Caroline, you make me sometimes feel smiling. Now, let's talk about the symptoms. Let me repeat about the symptoms. The symptoms, many patients remain asymptomatic. You can have this problem, but you remain asymptomatic for so long. Sometimes you feel dizziness, it goes, you are okay. Sometimes you stay, you feel some headache, it goes. It doesn't mean that you don't have the condition, but when it is worse is when you start feeling the real situation. Shortness of breath, and especially on exertion. Chest pain, angina, the central chest pain that people have, angina pectoris. Fatigue, palpitations, dizziness, sometimes syncope, loss of breath, and exercise intolerance. You see, these are the problems that you face, and then you have problems, and you share drugs, And because if you take some drugs the first day, even if they're wrong drugs, like you have this one and then you're taking a diuretic, it may slightly help, but you're not helping the condition. You may end up having heart failure, cardiac arrest, or sudden cardiac death. Sorry about that. If you are coming in right now and you are a new person to the channel, please don't forget to subscribe to the channel. Follow us. Like Kathleen Cruz, you see, is our new friend of ours. Big up, clean, safe, Kathleen. I was born in Santa Cruz, Jamaica too. Wow. Kathleen Cruz is Jamaican uncle. Kathleen Cruz is our new friend here. He's our new friend and he's a good friend of mine. He wants people to talk in the chat and ask questions. And she's kind of like, why are you people not talking? Eh? Why are you just listening to advices and you are not talking? Yeah. So let's continue. Many people, when they have this problem, you will hear some murmurs in the heart. You see, or the apex beat. Sometimes, you know, when you touch someone in the chest here at the left side here like this, you can see some, you can hear some two. But in hypertrophic cardiomyopathy, you will hear some forceful sustained apex beat. Apex beat is forceful and sustained. Now, a harsh systolic ejection murmur is heard. Kathleen Cruz, you know my name. Me or Jamaican uncle, you know, Kathleen Cruz seems to be a very nice girl. He wants people to interact, you know. And you know, when you come online, the best thing we do is interaction. The best thing we do when we are online is interaction. So the increase with the Valsalva maneuver, decrease in squatting and hand gripping. So those are the problem. When you stand, yes, I know Cruz. Yes, I know Cruz. When you stand, you feel the murmur increases. But when you squat, hand grip, increase preload and afterload, reduce obstruction. So when you squat or lie down, increases preload and afterload, so it reduces obstruction. You see, but when you stand up, it reduces obstruction by reducing preload. So okay, can you what you know? Where do you know my teacher's name, my friend's name? Can you tell me? So the complications are same. The complications are heart failure, atrial fibrillation. You can get a stroke, by the way. You can get a stroke because you are not pushing blood as needed. You can get a stroke, and then sudden cardiac death, infective endocarditis. You can get infective endocarditis. Those are the things that you can get. Can you end? Yes, those are things that you can get out of this. So when you want to know that you have these conditions, when you have to know that you have these conditions, what do? We do an ECG. I've always gone through. We are silent student of Kathleen Cruz loves Smiler. Kathleen Cruz loves interaction. So if you want to know that this is a problem, we do an ECG, endocardiogram, and then we check on the thickness of the ventricles, thickness. And when you are doing an ECG or echocardiogram, you check as in how the valves are and how they are constricting and relaxing. How they are contracting and relaxing. So you know that if they are not contracting and relaxing, you kind of like know that this is a problem. You can do cardiac MRI, and then there is something that is called Holter monitoring. Do you know Jamaica Kathleen Cruz? Yes, Holter monitoring by ventricular atrial fibrillations, frequent ectopic bleeds, all those. We check on all those. So these are the things that we look at and we know, oh, this is a problem that is not supposed to be like this. Exercise stress testing. Exercise stress testing is very important. It's very important. Exercise stress test provoked left ventricular obstruction. This one we will go through how to find out how a person has this problem. And then we will do management. The main important thing that you need to know right today, here we have not done something, we have not heard about alcohol. No. Here we have not heard about alcohol. Dilated cardiomyopathy, you've heard about alcohol, you've heard about smoking, you've heard about all those nutrition, lifestyle, but here mostly you've heard about genetics. You've heard about genetics, and then there are secondary causes like hypertension, but we have not heard here about smoking but sometimes smoking can cause fibrosis and cause the muscles to be obstructed and bad. So these are the things that we talk about, and these are the things that we look at and we say, there is a problem here, there is a problem here. Genetics leading to myocardial hypertrophy, leading to myocyte disarray. So this is not a very common condition, but in some families they are born with it. They are born with it. In some families they are born with it. They are born with muscles that are thick. Even contracting and relaxing is really a problem. See, so you who is there watching, and these are diseases of the heart that they are hardly diagnosed. You are always taking hypertensive drugs, and maybe you have whoever writes something in the chat, they are an angel and they love God. Yes, guys are coming and going. It's a Friday. A Friday is a day that people have gone to enjoy themselves, and they're woken up. Some have gone to work, some have gone to, they are waiting the day to end so that they can do what? Yes. So yes, coming. Vijana tunaona huko mbele, wakati hapa kimbia huko mbele kuna watu. Wakati hapa. So that is what I'm saying, cardiomyopathies, dilated cardiomyopathies. So anyone with any question? This, I want to take green tea. Sometimes when I'm discussing issues, I like taking green tea. Coconut water. No, this one is green tea. It is 5:42 p.m. here in Kenya. Kathleen Cruz, it's 5:42. So today, what you take home is you should understand that Sijo Kiru, I'm watching you from my TV. Sijo, how is you, by the way? I saw your text. You're always here, hitting the like button, following. I know you have gone through several things, and today is a Friday. A Friday we do several things like Feel Good Friday, mental health awareness. So after this, don't move away. I'm bringing another one immediately that is called Feel Good Friday. So everyone who has watched, what I want you to take home today. Today we did not have a very long talk. I want you to know that dilated are big ventricles, and they can be, ventricles are these ones of the heart, and they can be brought by you taking alcohol, hypertension, nutrition, and thiamine deficiency, not taking vitamin B1 deficiency. But now, when it comes to hypertrophic is a very funny one, whereby, English please, English, I'm talking English. Hypertrophic is a very funny one, whereby you are born with it in your family. Hypertension can come with it, and specific things like, let's say, like obstruction, amyloidosis, hypertension, aortic stenosis. Those are things that people are born with. You can have it. So everyone who is watching, thank you everyone for watching. Give me like 20 minutes, then I'll be back with Feel Good Friday. That's where we listen to music. I've been working since morning, and right now I want to bring another part of, it's a Friday we should feel good. So if you have been watching and you are a new person, go back to the channels, watch the videos that are there. If you have a question, after 30 minutes, not 20, after 30 minutes, come back. Let's feel good, and I'll answer all your mental health questions and medical questions. Thank you for coming in and listening to this. I've not finished this topic because this is bored. No, I'm not bored. I'm feeling hungry. I want to go take something, then I come back. So I've not done management of this. It's a different type of management than the other. Sijokiru, I'm not, I'm feeling totally hungry. I've not taken anything, and it's 5. And I have Feel Good Friday to do. So give me 30 minutes, I'll be back with Feel Good Friday. That is where you feel good and you will learn as you listen to music. So bye-bye. Your questions, let's meet after 30 minutes. See you. Have a good time.